Hey everybody, this is Modern Refugee. First time I've been out here in quite some time. Having a little vitamin T today because I'm still on a liquid diet. I haven't had any solid food in quite some time. When I was in the hospital, I was on IVs the whole time, and since I've been home, I've been on a liquid diet. But wanted to take a few minutes to explain a little bit about my illness, kind of what went. What of my preps went right, what of my preps went wrong, some of the things that I seen while I was in the hospital as far as shortages go, and just give you a little bit of an idea of what I seen here in the last couple of weeks. I always feel that the best information is firsthand information, and I wanted to go over this. Well, this is still fresh in my memory. um, I'm not out of the woods yet. I've got a long road to go yet, depending on what they're going to decide to do with me. I'm hoping to find out this week a little bit more of what's going on. I got to go for CAT scans. I got to go for consultations. I got to go back and see the surgeons and see how all that goes. But the first thing is I got sick, had abdominal pain, running a little bit of a fever, went to the ER. I was given some medication, given some antibiotics. I was sent home. I went home for about 5 days. And at that point, I went back and seen my regular doctor. They switched my medicines. And that particular night, I crashed out. Everything came back with a vengeance. The pain, the fever, and went back to the ER. And they told me I had diverticulitis, I had an abscess, maybe a perforation. They couldn't tell with what they had. And this gets to the first thing. Preppers always talk about, get out of the city, leave the city, you know, move out of the city, do that kind of stuff. It's kind of the mantra of prepping channels. You know what the first thing was that they did? They put me on an ambulance and they sent me 3 hours to the city. There is no decent health care out in the country. There are small hospitals, and those small hospitals do what they can with what they've got. But if something's really serious, the first thing they do is they transfer you to a bigger city hospital. That's just the way that it is. Another thing was is recognizing what was wrong with me. I knew something was wrong. I was way off baseline with the way I was feeling. I have, blood pressure monitors, heart rate monitors. My heart rate was up. Um, my blood pressure was out of whack. And I knew this from this diagnostic stuff that I got here. I knew something was wrong and it was beyond anything that I could handle here. I'm sort of a herbalist and I've got, my own way that I take care of myself. But this was something that I knew right away that was beyond me. And when I got down to the city hospital, um, one of the first things that the first surgeon lady that came in and talked to me said, "You're lucky you came in. If you would have waited 12 hours longer, you would have been in bad shape." So listen to your body. If you feel something's wrong, there's probably something wrong. So don't hesitate. I know guys, especially, hey, I'm gonna go. I'm just gonna tough this through or whatever. But sometimes that's not the best. And the next thing is the shortages as far as what I seen in the hospital. Now, I was in the hospital for a week, and the first thing that I really noticed is that I was on IV antibiotics, and when my symptoms were real bad, it was over the holidays. It was Thanksgiving, and they didn't have anybody there to mix the antibiotics that I needed in the IVs. So I went, I'm going to say 12 hours. My time frame's a little messed up because I was pretty sick and it's hard keeping track of all that stuff in the back of your mind. It's not like you got a pen and paper there where you're all hooked up to two IVs in your arms. But the way I figure it was about 12 hours, and I never received any antibiotics in that period of time. And the nurse came in and specifically told me that she called down to the pharmacy 5 times, but there was nobody to mix my cocktail, whatever that they were giving me. And when morning came around and I had a terrible night, they finally did get me hooked back up again. Well, then things started to progress in the right direction. And another thing that they didn't have, they couldn't find Tylenol. And after my fever had kind of went down, my pain had kind of subsided. So if they came around, they said, we can't give you any Tylenol right now because we can't find any. We're looking for some. We can't find any. As soon as we get some, we'll come back in. Well, they came back in about 8 hours later, and they said, "Well, we got some Tylenol and stuff for you know, do you want it?" And I said, "No, I kind of feel all right. If there's other people that need it, go ahead and give it to them because I'm kind of feeling all right." So that's kind of a basic thing. Another thing is I had IVs in so long they actually blew out, and they had to get an IV technician in to actually put an IV down in between my bones because you got veins and arteries that run in between your bones and your arm. They had to put that in with an ultrasound. And again, they couldn't find the right catheter needles and they didn't have the supplies that they needed to do that. They had to search around, took 3 hours or so for that to go in, on top of the shortages of not having people. And there was another nurse that I had, really good guy. He came in the middle of the night carrying a whole arm full of IV bags, the nutrition bags that they were putting into me, carried them in, and he says, "I'm going to hide these under your clothes so you have them when you need them." He said, "Because if I leave these in our storeroom," he said, "they'll be gone." And he said, "You won't have any." So he says, "I'm going to go hide these underneath your clothes." And well, then I had enough then to go through. Now, all these people, all the nurses and the nurses' aides and everybody came into me, they did nothing but try to take care of me. They looked after me. I have nothing but praise and thanks for those people, 100%. But it was obvious that they were lacking material and they were lacking manpower. And that's the state of our world now. And that is, unfortunately, I'm afraid that is going to be the norm for quite some time. Most of them were quiet professionals, and they kind of took it in stride, explained to me what was going on, and there were other patients that weren't quite so understanding that they were having to deal with, but I didn't give them any problems because they had a job to do too, and but I have nothing but praise for those people, but I don't feel that those things that I've seen, those are kind of normal operating procedures of a hospital. Now, I've never been in a hospital before, so I don't know 100% if that's how things are supposed to work one way or another, because, I've only had to take care of people in the hospital. I've never been the one in the hospital myself. So that's the way that stands. Now, my get home bag and the stuff that I carry with me all the time. In this particular situation, was pretty much worthless. My get home bag and all the shelter kits and all the water bottles and all that stuff that I normally carry, because I always envisioned, and it's happened to me before, where I've either had to walk home or something had happened where I had to spend a night in a vehicle. My kit and my bag and stuff wasn't designed to handle an unexpected week in the hospital, which is exactly what happened. Now, I did have a change of clothes in my vehicle, which was good, and I did have all my charging stuff for both. I had multiple sets of charging battery packs, cables for different devices and stuff. So those things came in handy. Those things my wife grabbed, and I had them right away. And the other thing is, I just said recently, a cell phone. Have spare cell phones and stuff. I actually had one person comment on there, that he doesn't need a cell phone and, he's got an answering machine or whatever. If I would have had to navigate everything that took place in the last 2 weeks with me with just a home phone and a answering machine, with the family and the work and the leave of absence and the doctors and everything that I needed, I don't know how I would have done that with just a regular dial telephone. Um, because it's a combination of things. I had to have access to the internet. I had to have access to texts. I had to have access to a phone to, facilitate my care. I don't know how I would have done that with just a landline. So, for my situation in this particular time, I was very glad that I had the phone. Plus, I had everything to charge the phone. Plus, I had multiple charges, and that was kind of the good things of having in my pack. So, the change of clothes and the battery packs and the chargers were the most important thing that I had in my get home bag. And the first thing that I did when I got home, and literally, it was literally like an hour after I got home and I kind of got situated, I took one of the bags that they gave me at the hospital right here. It's about as OPSEC as it's going to get for inside a hospital. And I put 5 days worth of clothes in this. Just things like socks, toothbrush kit, deodorant, soap, underwear, shirts. And this right here is going to sit by the back door. If I relapse or if I have any problems whatsoever, because I was given strict orders when I came home, if I have any symptoms whatsoever, I'm supposed to go right back down there to the city where I came from and basically check myself back in. So I wanted to have clothes and stuff squared away to grab and go. This isn't your typical bug out get home bag that you see ever. But things have changed. The situation has changed. So I have to adapt to that changes and have what I need. You know, am I ever going to take those bags and packs out of my vehicles because of this incident? No, I'm going to constantly keep those in my vehicles. Am I going to change my outlook a little bit on that? Yes, most definitely. And maybe break it down and have a couple different bags because I'm a big one on keeping your stuff spread out where stuff can be grabbed. Now, that was one thing, keeping your stuff spread out so you can grab what you need. That's kind of how I got my place set up here. So when my wife did come home, while I was being transported down there, of course, I had that little bit of stuff that I had with me already, but then it was easy for her to go ahead and just grab me some clothes and some socks and some underwear and some stuff to get me through. And she brought that down, so it was easy enough for her to grab that stuff here. But I just want to touch base on all these things here, kind of the shortages, kind of what worked, kind of what didn't work. You gotta, when there's a problem, you don't want to hesitate. You say, hey, what, something's not right. Get checked out so you don't have problems. I guess that's the main point of this. And things aren't what they used to be just a few years back. So I wanted everybody to know about that. I wanted everybody to learn from my experience so they can figure that into their own situation. But anyway, this is a modern refugee, just sharing my experiences. I'll try to put out another video again when I feel good enough to do it. And I appreciate all your guys out there and all your guys' well wishes that you've given me over the last few days here. And you guys take care.